Overhead throwing injuries can result in elbow injuries to skeletally mature and immature athletes. Most often, these are going to occur during late cocking into acceleration and deceleration phase. There are several contributing risk factors, including rotator cuff weakness, which occurs in all of the rotator cuff muscles but the subscapularis, GERD, which is glenohumeral joint internal rotation deficit, or scapular dyskinesis. In the adult, the UCL instability is very common, as well as an ulnar nerve neuropathy or a flexor pronator mass strain. In the adolescent, we are more likely to see little league elbow. This is a unique injury to adolescent athletes that involve an open apophysis versus the epiphysis plate at the medial epicondyle of the humerus. An apophysis is an outgrowth or a projection on the side of a bone, and it is usually where a tendon attaches. So little league elbow is defined as inflammation or avulsion fractures to the medial epicondyle apophysis due to tension from a valgus overload and or repetitive tension on the flexor pronator mass. This occurs in young athletes, typically between 9 years old to their early teen years, and generally is going to affect pitchers and catchers. The mechanism of injury is a high valgus stress that occurs during the overhead throw. This stress causes the medial epicondyle and the apophyseal growth plate to open. There are several potential risk factors specifically to little league elbow, including the number of pitches that occurs during the game, the season, and the year, the type of pitches being thrown, pitching mechanics, and physical conditioning. Signs and symptoms include edema over the medial epicondyle, pain localized to the medial epicondyle region, including the flexor pronator mass, the ulnar collateral ligament, and the ulnar nerve involvement, and then pain and dysfunction with overhead throwing. You will see a decreased active range of motion and passive range of motion with elbow extension. The special test you will perform is the valgus stress test in both 0 and 30 degrees, with 0 really checking to see if there is an opening at that apophysis. Neurovascularly, you will want to check the ulnar nerve. The diagnosis is going to be through an X-ray. With little league elbow, there is prevention. The athletes need to be taught the proper warm-up and cool down for the throwing. They also need to be shown proper biomechanics. There should be proper neuromuscular control and function of the shoulder region. And finally, we really want to make sure that the athletes follow rule limits of the number of pitches and innings thrown, as well as rest period in between games.